So this is Chris. He actually ended up buying, if you look, a lot of my equipment is gone in the gym here. We actually ended up selling, and we're moving down to Greenville, South Carolina, so we're relocating. But he ended up buying the equipment, but then he told me he had some shoulder issues, and so that's what we're going to work on today with him. And why don't you just talk a little bit about your injury and what you're feeling?
Yeah, so years ago I had shoulder surgery and stuff like that from benching and everything, and just I'm losing contraction back in my back and my shoulders, and I'm finding muscle groups are just overactive in certain areas, and certain groups are getting stronger than other ones. So it's like working those little muscle groups here and kind of learning how to activate those, and that's what I'm here for, to have for him teach me those little movements right there.
And so you were a powerlifter for how many years?
Since I was 14, so almost 24 years ago.
And you benched almost 400
500
with a shirt or whatever.
Yep.
And what kind of tear did you have?
They just shaved down the AC joint. It was just supposed to be minor surgery, but.
And you were benching the other a couple months ago, and something just popped and pulled on you?
Yeah, it was this side here. I had some issues going on, and then it turned into this side here. So it's kind of like fighting back and forth here. So it's kind of like something's not right.
So if we look at his shoulder, if we look at it, he's trap dominant. So this shoulder's, if we just totally relax. So if we look here, okay, this shoulder's rounded forward this way, the trap's jacked up this way, and you're gonna see when we look at some of these muscles, he's basically all trap. So his rear delt back here, if he turns around here, the rear delt here, go ahead and make a rear delt muscle, just kind of flex. Like this whole cap right here, there's really not much development. And when you do Pec Deck, he doesn't feel his delts when you do Pec Deck. So we're gonna go through a whole process of one, teaching him how to depress his shoulder down, and two is developing the rear delt. So let's get into that now. What you guys have to understand, I'm going to explain this after I get into the technique, is how to position the humerus head so we can get the scapula to drop down. And it's going to be counterintuitive to everything that you've been taught by PTs or trainers. But go ahead and let's just look at the technique. So bring it back. Just bring it back. We're going to keep the elbow right in line with the front of the shoulder. And then what I want you to do is he's going to bend your legs a quarter of the way, put this hand here, keep your posture nice and erect. And now we're going to take his shoulder and we're going to line it with the center of the ear. So let it roll forward just a little bit, right there. Now, he can actually depress his shoulder down, push down. Bam. And then we're going to light up this spot right back here. You feel that?
Mm-hmm.
So we're going right here in the back. If you look, babe, right, we're trying to light this up, this teres major. And if you look, there's no development there on this, because his scap's just been taking over and dominating. Every time he's doing back exercise, he's here. So he doesn't have any depression to really develop that teres major there. So we're going to go here, look from the side again. And all he's going to do is, he's a little bit wide here. We're going to get him in a little tighter there. And if his elbow comes back, pull your elbow back. Look, keep going. Do you see how this starts rounding forward, and you see how this starts picking up? So he's got to keep this elbow in front of the shoulder here, and he's got to align that shoulder with the ear to depress down. And he's going to stay in this position for literally 4 weeks. I'm just going to have him hold it. And then what's going to happen is, good, take a break, that's good. Then what's going to happen is as he's able to depress down and he starts developing a little bit more of the muscle fibers there, I'm going to say roll back. And when he rolls back, rather than it lifting up, he's going to be able to go down at 45 degrees. If he tries to do that now, and I'll show you, if he tries to roll his shoulder back, it's going to go up because the trap's going to come up. So we got to depress down, master it here, and then as the depression starts working, then we can start dropping it down. And the scapula, we're trying to get the humerus head to align with the scapula. His scapula is here. So as we need to depress it down here, and then over time it's going to roll back this way like a gear. And then we can get into the teres, and we can start getting the posture rather than him looking like this. Then he can be down and back. All right, let's do one more set, and let's show that roll.
Do the right side or left side?
Let's do the right side. So we're going to go here. His elbow's got to be in front. If it goes back, the shoulder's going to lift. Exactly. Now he's center lined. That's perfect. A little bit more in here. And now watch. Watch what happens. Go ahead and keep your elbow where it is and roll the shoulder back. Do you see, look what it did? It went up. That's how you know he's not ready, and you didn't feel it in that spot, correct?
Right.
you started feeling it more here.
Up in
So
front.
if you watch me, gotta take a break. If you watch me here, I'm here. So I'm gonna put myself in the same position as him. Now watch my shoulder though. So his, when he rolled back, it went this way. When mine rolls back, where does it go? It goes down at 45. And now I feel the intensity increase. So everyone's gotta start here for like 3 or 4 weeks, developing it in that position. And then how do you know to roll back? Because when you look into a mirror or a camera, it starts going down this way. If not, there's no point. You're just gonna get your traps. Good?
Yeah.
All right, let's move on to the next exercise, and we'll go from there. So now what we're going to do is, as we worked on the downward depressors of the humerus head, now what we're going to do is we're going to work on basically the back cap of his rear delt, all right, which is really underdeveloped. Talk about what you've done for rear delt over the last 20 years.
Band pull aparts, the Pec Deck, reverse Pec Deck, rear delt raises. But like we were just talking about, a lot of that stuff is trap dominant and lat dominant.
Right.
So it's kind of trying to pinpoint that specific muscle group.
So what we're going to do is he's going to take a step back. He's going to start with this exercise. We're going to show you the thumb down raise to really isolate the rear delt. Once I get that fully developed, then when he goes back into things like face pulls or pec deck, now it's going to be working in unison with the mid traps. That's what we have to do. So let's work on isolating. So we're going to put our knee here. We're going to get our side of a hip on the bench here. I want you to be pretty open, turn down just a little bit. But the key is to actually be below your waistline here when we're doing it. We're going to get into specifics. But this is how he's going to need to start in order to develop his rear delt. Because if he comes up too high, he's just going to trap out.
Yeah.
So we're going to start at a lower plane, develop it there, and then we'll move from there. Get your knee a little bit up higher. And we're going to straighten this leg out here so you're more comfortable. Yeah. And then get this hip like this. Yeah. Good. This is a big, thick dude here. And he still didn't have his rear delt developed. That's why he ended up getting hurt. Okay, so what we're going to do is we're going to touch here. I only want you to come 5 or 6 inches in front off your thigh. So right there, that's your start point.
Okay.
And now, just stay right there, don't move. You're just gonna hold that. Now watch what I'm gonna do to hit. Push your trap down. Push that way. That's where I want you, and I want you to concentrate here. Open your chest a little bit more. Like roll your chest open. The other, this way. Yeah, like get more. Yeah. There we go. That's where I want you, right there. Pull that wrist back. And really reach there. Do you feel you're really pushing that trap down? Now hold that. So I'm taking this completely out. This thing is so developed, it just wants to take over. And then I want you to think about that piece right there. He's about like maybe 6-8 inches off. Okay, he could actually come a little bit more wherever he feels the most intense. And what we're trying to work is this piece right here, babe. If you get over top, there's no development here. I mean, look at how thick this is, but there's nothing here. So that just shows like pec deck and all that stuff. It doesn't matter if it's underdeveloped. Do you feel that?
Oh yeah.
And that's only
little tricep too, right?
little tricep. If you don't want as much tricep, just less or about the same.
About the same.
Okay, it doesn't matter, but you feel mostly here.
Yeah.
You're gonna get a little tricep as you're locking the arm out. Let's see the other side. Put that hip on just a little bit more. Get up way up over this bench here. Okay, ready? So let's touch that thigh, and I want you to try to turn on your side more. Yeah, like really get your, that's what I want, like that. Yep. Let's touch 5 or 6 inches out right there. And yes, there, like that, hold. That's the key, guys, is to push this down this way, that way, almost like you're learning over there. We're gonna turn that down, stay a little lower.
There you go, I feel it now.
So do you see when he was coming up, he was turning here. We want to bring it down a little bit lower. He can't come up that high. If he does come up high, okay, trap's going to take over. So literally, we're going to work on just holding this. He will move with it probably by next week. But right now, I just want this. You feel it?
Yeah.
He's killing. Right there. 4 pounds. Here, right in the back of the calf. It's okay?
Yeah, it's burning. It feels good. It actually feels like it's working.
Now this is your left side, right?
Yep.
And it's easier to activate than your right.
Correct, yeah.
Because the right side is really jacked up this way, right? He's right-handed. If you're right-handed, you're constantly going like this, and the left hand pulls this way. If I throw, it pulls this way. So usually it's a little bit more anchored, and the Teres works a little bit better on the left. Let's do the other side. I'll teach you how to move with it now, but when you move, it's only going to literally be micro movement. So let's get the hold down, and then we'll go from there. Good. And lean back just a little bit. Push that down. This side just doesn't know how to anchor.
No, it doesn't.
It's just floating, because he's got to develop that more there to get this to depress and then roll back. But this will start develop as that gets better. Then this gets better because he'll start being more aware.
Are you almost like trying to push the weight that way too?
Yeah, you're trying to reach. You don't want this to roll forward, but
Right.
you're not trying to pull this back.
Right.
You're just trying to push your trap.
Right.
Just
Okay.
get your trap out of there. Yeah, that's good. Pull that back. That's not bad right there. That's pretty good. It's twitching. Feel here?
It's waking up.
Yeah, it's waking up. Now, if you're gonna move with it, come to here and back to here. Freeze. Yeah. Yep. Back down and up. Back down and up. See how much? And I'm gonna put this up higher. Watch what happens to his shoulder. Come up a little higher. Do you see how he starts lifting with this trap? So his movement is literally good to there, and that's gonna turn it on big time.
So if you had to go all the way up here and more out like that.
Yeah, but you can't right now. It's
Right.
just gonna get a trap.
Right. Whew, that burns.
That you felt it when
That
we were
burns.
moving.
Yeah,
So
yeah.
that's where he starts. Everyone thinks, oh, I'm just gonna go up and down, up and down. Then you're gonna get trapped because he's trap dominant. If I started an athlete out when they're 15 years old, they didn't have traps like this, it's much easier. So here's the pec deck, and what we've done is I've really raised him up so his hands are almost in line basically with his armpit. The problem with this is he's not going to feel as much rear delt as what we did over there because it's still too high up. He's got to develop that. There's 3 different levels to it, and that's why we have the app, and we show on the exercise the different levels to it. But you saw that's level 1. He's going to need to stay at level 1 for at least like 3 or 4 weeks and really just get the connection, and then we can move to level 2. All right, let's go back. Push your shoulders down right now. Look at how his traps immediately turn on. Right to there. Now go forward. And he's pretty good. Like he's got a lot of connection to his body. I want you. Did you feel what I just did there?
Yeah.
So I'm going to kind of lift through his chest. Yes. Do I do this and lean over? Yes, because I've had it so developed to here. His goal is to get it all the way back to here and be able to keep his shoulders down. And if he can't keep his shoulders down, then he's going too far, or he gets too much trap. That's why the range is very short. That's it. That's all the farther he should be going back to connect. You feeling it here now?
Oh yeah.
So for the first time in your life, you're feeling your rear delt?
Yeah. After you get to like 25, 30, then you start feeling them.
Yeah. Yeah, yes. So we're getting that back cap right here. This is where he wants to feel it. And those traps want to turn on so bad.
The right one does before the left one.
The right one wants to turn on before the left, which is normal. Right-handed people, they're always going to end up like this. So we're trying to get everything to anchor down and push back. Yes, yeah, he's got it. Now take a break, brother. So let's do a regular pec deck. So I'm going to take this off. I'm going to bring you down a little lower. Now watch.
See right here?
Let's just go right to there. And watch how it's harder to keep your traps down. Correct?
Mm-hmm.
So just that little height. Arms go up a little lower, more trappy, right?
Yeah.
More trappy. Look at that. Okay, so that's why when you're on a pec deck, when you're first learning, it's got to be down. Everything's got to be down lower. You got to raise yourself up. All right, let's get on this. Yeah, if you want to go again, I would raise this up. Right to there. That's just, now, see how you can really keep those, that's what I want, right to there. Yep, right there, right there. Did you feel how you're getting now? You're getting that to recruit as well. Push that down and feel the Teres work too. Yeah, there it is. Yep. Yes. See what I'm saying?
Yeah.
Yes, that's it. He's got it. If you look from the side, babe, right to there. See how he's really pushing these down. So could he start with pec deck instead of that? If he understands the connection to muscle, I would say yes, but I would say that is a sure way to get him to where I want. So when he comes over to pec deck, he already has a foundation, and then it's so much easier then to get into it.
So you even try to go back further. I don't even know if I can work. So
if you go back further, you're not going to be able to depress. You see how it starts lifting?
Yeah.
So no point. All right, that's good on this. So what did you just say when we were walking back over?
Yeah, so like I said, doing band pull aparts, doing the rear delt raises, or just the pec deck stuff like that, the rear delt raise. You always think you're working those muscles and never felt that specific area there, so that makes 100% sense.
This is a years of a lifter.
Yeah.
Like, you can't take that away from him, and he still doesn't have the development there. And he's been doing all the rear delt exercises till he's blue in the face.
Right.
They haven't developed his rear delt. That's my point.
Right.
Now we're going to do external rotation. Tell me what you've been doing for external rotators.
So we'll do sitting on the bench, taking the arm down, laying flat, coming across, using the cable machine, cross.
High ones too?
High ones, yeah. Even with the bands, taking like the band, coming in tight like that, which I actually feel those a little bit. When you grab just a little mini band, keep your elbows in tight.
Because then you can kind of push down.
I like that. Now that we're all getting into this now, my mind's thinking here, but doing those, I feel those a lot back there. So now that you say that.
So let's talk about where to feel it, because I think even that. So we're going to drop them down literally to 2 pounds, and I'm going to show my external rotator cuff exercise. But where we want to feel this is if he turns completely. If this is, here's the armpit, I want him to feel it. Good, let that drop down. In the groove here of the shoulder. Here's the rear delt right here. Underneath there, infraspinatus. This is exactly where I want him to feel it. If he gets a little rear delt, it's not the end of the world, but that's where we want him to feel it. So go ahead and lay on your side. Now, I want you to take your mind away from everything you ever thought, okay, about external rotation, and just lay completely on your side. We're going to put this here. I'm going to position his elbow so it's a little bit in front of his hip or right directly in the center, depending on where he feels it more. The other thing we're going to do is, you see I'm at 90 degrees right now? Okay, now you don't have to watch this. I'm going to just talk to the camera. If I move my elbow ahead, do you still see I'm at 90 degrees, but my wrist now looks like it's inside the bicep. Not because I bent it, but because I moved it there. So you want to be a little bit there, and that's at 90. Okay, and now your wrist is a little bit inside the bicep.
Okay.
Now, I don't want him going higher than this to there. And all I want you to do is concentrate on that. Don't try to push down too much. Just let that relax and just go up and down. It's turning on. Feel it?
Oh, yeah.
With this, you can depress it down a little bit. You just don't want to be too aggressive. You're not trying to push into the pad. I just want you to get a nice burn in that spot. Connect to that. He's connected. I'm putting my thumb in the muscle so I can feel it vibrating. That's how I know if somebody's really working it. That's 2 pounds. Are you getting a burn there?
Oh my God, yeah.
Okay. He hasn't been working his infraspinatus. When he's doing this, I can lift my trap up and go like this, and that's what he's been doing with all his external rotation exercises. He likes this one because he can feel like he can anchor down with the band, but everything else is trap, trap, trap.
Yeah.
He's using 2 pounds, and that's good, right?
Oh yeah. Yeah, I never felt that specific spot there.
It's starting to burn out.
Yeah.
Okay, let's do the other side. But this is my point. So he's going to take that weight, and he's going to use that for the next week or two, and he's going to go up a pound, another pound. The goal on this, I like 5 pounds, being someone to do that. That's how, and only feeling in that spot.
I don't know if I'm going to be able to feel this one.
You probably won't.
Yeah.
This side's going to, don't worry about it. Just let it relax. Let it roll forward just slightly, and then push down just a tiny bit. And now up and down. Go ahead. Right to there. I don't want you to go any higher than that. To there. Yes. And if he doesn't, if it's not perfect today and he doesn't feel it, I don't care. Like all these other exercises are gonna, as long as you're not feeling it in the front or side of the shoulder,
Yeah, no.
That's all I care about.
Yeah, definitely don't feel this as much.
Yep, you won't. Because his shoulder's not anchored down with all the other exercise. The rear delt, the teres major and downward depressors. Once he starts building those, Then when he goes to this, it's going to start turning on more. But he can't. The shoulder is just floating. And even if he depresses down, it's just not going to be the same. Stay a little bit more here. Go ahead. To there. That's how high I want you to go. That'll start turning on if you stay there. 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 To there. Do you feel?
Yeah.
That's his connection. Do you see? That's where it locks. Right? There. Bam. That's as high as he should be coming. That's his true external rotation if he's really keeping his shoulder a little depressed down in that position. Turning on more?
Yeah. I feel in a different spot than I do my other side.
Right.
Like I don't
it's kind of like more here.
I don't feel it. I feel more in like my lat.
And it'll turn on over time, but that's fine. That's where you're going to start out.
Yeah.
Just don't push down too hard this way. You don't want to feel the lat working. Okay, that's good. So one of the things that he's been told is about the lower traps, right?
Yeah. Yeah.
And what do they tell you to do for him generally?
I'm doing like the TYIs on the bench, the dumbbell raises. I don't know why. Work on locking that down there a little bit.
And if we look at him, if we turn around here, like, okay, yeah, he's thick through here, but you can see there's no lower trap development. Yet, how many years have you been doing the Y's, T's, and arrows for? Years.
Yeah.
Okay. Because when he does that, his shoulders are going to shrug up and he's going to get his traps. That's why this exercise here, that one arm row, we're depressed. Why do we want the lower traps? Because we want the scapula to depress down. Well, the only way I can get it to depress down is if I can get the humerus head to depress down. Now it's going to take the scaps and it's going to bring it down. That's why this exercise is so important, because now when he pushes down from here, bam, now he's going to start getting his trap to drop. And as he starts getting deeper with this exercise, which he's going to take a month, after about 4 weeks, then we can start rolling this back, and now we're going to engage the lower traps even more. And now the scapula is going to start dropping this way, rather than Y's, T's, and arrows. Everything's going to lift this way.
Right.
Now, when he's built up, can we do Y's, T's, and arrows? Yeah, because now he's actually going to feel the lower trap working. He doesn't. Did you ever feel your lower trap working when you were doing it?
Yes and no.
Yes and no.
Yeah. Not like this. Like I said, these.
Yeah, we're not really. You're not going to feel the lower trap much, but he's going to feel the Teres. But this is going to anchor everything down, so the scaps go this way, and then anything he does now, the scaps are going to drop down, and then that's.
Well, but it makes sense too, because it's both sides. It's not just the left side. It is the right side too. Like it'll go from this side to that side. So obviously both areas are weak there, like you said. So building both those up will really help.
Now, we have that other exercise you see, pants pulls. If we go do that, like if you look here, babe, go take a look at this. If we look at the thickness and development here, I mean, it's pretty developed. Okay, we're going to show him. It could get a little bit more defined, but he definitely has some muscle development here. I don't think that's the major issue. I'm going to show him that exercise now, but it's not going to be a major determining factor. And a lot of the time, I don't even worry about pants pulls for the first like 4 or 5 weeks, because I want to get that shoulder anchor down, because when they do pants pulls, everyone shrugs up. This is going to be probably impossible for him right now to do, because as soon as he pulls his arms up, his traps are going to shrug up. So actually I'm making a decision that we're not going to do pants pulls with him, because I already know it's just going to trap up. Right. So we're in 4 weeks from now, I'm going to show him how to do that. And with pants pulls, what you really want to do is shoulder's going to drop down this way, and then you come up. If he tries to do that, it's just going to be anchored like that. So there's no.
And it's on our app, right?
Yeah, you got to go to the app if you want to see it. And it's a website app. It's not. We don't have it in the app store
yet.
All right. Yet. Go tune in for next week. We're going to show another episode, and also leave some comments down below, and just tell us your thoughts on some of these exercises and what you're feeling with your shoulder injuries.